right, as we continue this morning right here on Sunrise, this morning we're talking about polycystic ovary syndrome, which is a problem in which a woman's hormones are out of balance. It can cause problems with your periods and make it difficult to get pregnant. To talk more on these, we're joined by gynecologist Dr. Bandile Masuku. Thanks for joining us this morning. Okay, I hope I pronounced this thing correctly.
It's polycystic ovary syndrome.
Polycystic ovary syndrome.
Yes.
Okay, what exactly is it?
Like you said, it's a disorder that is characterized by hormonal imbalance. And this imbalance usually shoots off the male hormone that is testosterone. And then it manifests differently in different types of age groups of women. In younger women, because of testosterone, excess of testosterone that they produce, they normally get abnormal periods, as you've said, and then also they get problems related to testosterone, acne, which is one of the biggest problems that we see in teenagers and adolescents. And then in childbearing women, the difficulty of falling pregnant. And in older women, you might find that they normally have some degree of developing cancer of the uterus. So the issue here is only about it's about hormonal imbalance, but it's also associated with increased BMI, which is obesity, which is mainly lifestyle orientated. Okay,
so let's talk about this hormonal imbalance first. I mean, is there something that you can do to correct that?
Yes, the issue is that if you, that's why I put it in terms of manifestation in different age groups, because the treatment is different, you know. For in younger women who are in adolescence who just started menstruating, then the hormone imbalance can be treated with oral contraception, which has also some of the contraceptions that we use, they have the ability to lower the testosterone, which works well with the skin, works well with the hair, and for them it then controls the periods, and they get normal periods. And then for childbearing women, it's a total different approach altogether, because yes, you have to control the periods with oral contraception, and then you have to make sure that they have the ability to fall pregnant.
Okay, and then you said at a later stage.
In later stage, yes, we have found that women who develop cancer of the womb, of the uterus, usually had initially a problem of PCOS, which is how it's abbreviated. Okay. PCOS.
So now let's get back to the one about obesity. And you also, if there's also a link of symptoms of PCOS, how do they relate to insulin resistance?
Yes, that's where the issue is. You know, remember when you get type 2 diabetes, it's when your body has an inability to store away and deal with excess glucose in your body. And because of that, and with the association of increased BMI, the hormonal imbalance, because when you've got a big body, or when you're obese, fat also adds extra hormones. It acts as an extra ovary. That's what we say.
It acts as an extra ovary.
Yes, because all the hormones that get produced in our body, they are precursor material is lipids and is from fat. So if you get excess fat, then you're going to produce excess hormones like estrogen, progesterone, and then the other one that we don't want to see in excess in women, which is testosterone.
Okay, so I got some comments this morning from our Facebook page, and questions rather. Yolisa Naomi Campbell saying, I have been trying to conceive for the past months and been unlucky. I have also had irregular periods. How do I make them come back naturally? Do I need supplements?
Yes, you need oral contraception, like I said, which has got the ability to lower down the testosterone. We have them in the, on the market. Though the people that have got acne, they will tell you they know the brands that they normally use. So you need that for 3 to 6 months, so that your body gets used to the ability to go through periods every month and restore the cycle. And then afterwards, then you can be able to stop them, and then have something that we use if we really need to induce ovulation, where then you can be able to fall pregnant. But the other things that are just mainly on diet, and weight loss. We normally teach that 10% of weight loss might restore your ability to go back to your normal periods. But then that has been a struggle, but it's something that we encourage all our patients to try to limit their BMI, control their diet, so that we are having all the things. Most of the problems we see in gynae or in women's health, if you have to ask anything, obesity is the underlying issue.
Is the underlying factor. Is that the biggest challenge we face in the country?
And now it's increasing every day, whether it's pregnant women, whether it's women with abnormal bleeding, like women we're talking about with PCOS, obesity becomes the main challenge.
Okay. All right. So we've got another comment in Nyakalo saying, good morning. Is PCOS manageable or curable, and affordability of healthcare?
It is curable. Actually, it's manageable because it's something that you have to manage and deal with as it goes and in different stages, because when you have it in your adolescent years, it might proceed, actual progress. And with our lifestyle and our issues, we find that, yes, when you get big, obese, then you have the problem of having the inability to fall pregnant. The issue here is that you have to restore your cycle. You have to have normal periods, and then you'll be able to fall pregnant. Okay. And few things that have to happen. Almost not that women who are obese can't fall pregnant, but it's just difficult, particularly if you have other underlying cause like PCOS.
Okay.
You are within the period of we call it perimenopausal. So you are around the period of menopausal.
Okay.
Usually it starts around 46 years and completely women menopause at around 52 years. We normally teach to say 52.1. I don't know where the 0.1 comes from, but averagely we say all women menopause at 52.1. But now, because she's within that period of time, maybe we needed to have asked her about other symptoms of actual menopause, like the one that is common is hot flashes. And the other one is vaginal dryness and change of mood swings. And one of them is also abnormal bleeding once in a while. But if she doesn't have any underlying thing like your diabetes and she had normal pap smears, then I think it's a normal process. But she needs to check out, do a pap smear, and then they have to do a sauna to see if the lining of the womb is thin enough. First, establish that does she have
that's what
periods.
She said. She has a period every month.
And secondly, that does she have intercourse at the right time, because also the issue of timing of intercourse is important. Yes, our parents would have been the ones that get surprised when they are pregnant, but with our generation we can be able to time when to have intercourse to have maximum effect of actually falling pregnant.
So she has to, when is the right time? If she,
usually,
if that's the next question.
When we count the cycle from the first day when you see a first drop of blood, and we count up to around the 12th day, which between the 12th day and the 20th day, it's where ovulation does happen. There are some devices that you buy in the pharmacy which can give you an accuracy of time, but if you count it like that, and between that time is a time that you can have intercourse, and you've got maximum time, maximum opportunity of falling pregnant. But falling pregnant also is that we don't say a person is infertile in two months. It takes almost, in terms of definition, and what we teach is that it should be almost 6 months to a year. And if you stay with a partner, the statistic says that it goes up to 92 to 94% of the chance of falling pregnant, unless there's something else happening, smoking, drinking, obesity, those are things that needs to be excluded. If it's normal health, everything, then we try that. Usually everything is good to go. Okay.
Just lastly, what is the treatment, of course, for PCOS?
Because, like I've said, the main thing is lifestyle, orientation and manipulation. So maintenance of good BMI is one of them. And one of them is that when we say 10% of weight loss, other people think is a big jump, but it's something that can help. And we've seen that just only on weight reduction, your periods gets to normal and your ability to fall pregnant it will improve. The second one, if you have to use drugs, is oral contraception. The oral contraception that have got something inside that will drop testosterone levels or male hormones, androgens, because other things that they do have hair, extra hair and beard and other things. So those women that you see, they might, with hair and others, you might see that they've got PCOS. The other one is surgery, but surgery is only left for a last option, like as a last option, where we do a laparoscopic surgery, a keyhole surgery, where we'll then drill holes into those cysts. Yeah.
So for those women who might have like hair, so you're saying that they can go on a treatment to help them with that?
Yes, there is oral contraception that does help to reduce the androgens level, which is the male hormone, and that's the one that usually gives us all these extra effects of men.
Yeah. Okay. Thank you so much, Doctor.
Thank you so much
for the information and for coming in on the show this morning.
Thank you.